Hi, good morning, everyone. Welcome. We're so happy to be with you this morning. I'm going to start out by actually sharing a little poll for us all to take. So you should be seeing a poll on your screen. I know we have people joining us from across the state of California and even maybe a few people from out of state. We just love to know how you're connected to this project. Great. So I think most of you have filled out the poll. We'll keep it live for another couple minutes because I know some people are still joining us. So again, just want to thank you all for taking an hour of your morning to be with us today. We are really excited to share with you the Kinship California Navigator Program. We launched our program on May 31st on World Foster Day, and so we're really excited to share more information about it with you today. This will be the first of a 3-series webinar, so we're hoping that you can join us for the second and third. Before we get started, I just want to let you know that we are recording this. So if you would like to change your name so that it doesn't show up on the recording, you can go ahead and do that now. You can just click on the More button next to your name and click Rename if you would like your name to not show up. So give us a couple moments to do that. I also want to let you know that just to keep things running smoothly, we have muted everybody in this webinar, but please feel free to leave any comments or questions in the chat. Melissa and Nayeli, who you can see on video, are helping monitor the chat, so we're hoping to get to all of your questions and comments. All right, it looks like there's just a couple people left on the poll, so we'll continue to keep that up. I'm just going to quickly go through kind of our plan for the next hour. So we're starting off with just a welcome, and then we will meet the team that's responsible for the KinshipCareCA project. And then we'll do a review of the model and concept. And then we'll spend some time actually demoing the website so you can see in real time how the program looks. And then we'll talk about different ways to get involved and stay involved. And then we're hoping to have 15 to 20 minutes for a question and answer session. So again, feel free to write your questions in the chat. And if we can't get to them during the actual presentation, we'll make sure to answer them during the end of the meeting. Okay, I'm going to go ahead and end the poll. Great. So we'll go ahead and get started. So I want to start off just by defining what the kinship community means to us. So the definition that we use is here on the screen. So many children and youth are raised by relatives other than their biological parents, both formally in the foster care system and outside of it. So this is how we define kinship. And now I want to share with you some of the great partners that we're working with on this project. So this program is being led by a dynamic team of all of the organizations that you see on the board. So United Ways of California, we work to improve health, education, and financial results for low-income children and families throughout the state by enhancing and coordinating the advocacy and the community impact work of 30 local United Ways. So we have 8 of our staff working tirelessly on this project, and we are also supporting and working with more than 20 United Ways throughout the state of California. We couldn't do any of this work without the 211 program. We rely on local resources and program data from 211s throughout the state. We currently have information on health and human services from 54 of the 58 counties in California. Together, we've built a shared data repository to hold the resource data and provide access to it through our Kinship California navigation portal, and we'll show you that a bit later. We are really happy to be partnering with 211 Ventura, which is a program of the Interface Children and Family Services Organization. They are our key partner in assisting us to compile and data for the shared repository, and also in providing live real-time help to our kinship caregivers and families throughout the state. 211 Ventura provides information and referral services to over 40 counties in California, and they assist more than 300,000 residents every year with voice, text, or web searches for health and human services. We're also partnering with the Data with Purpose LLC. They're our key evaluation partner. They have over 20 years of experience working in the kinship field, and we're really honored to be working with them. Data with Purpose is helping us to understand the kinship caregiver user experience and how to improve that going forward. And finally, we are a very proud partner with the California Department of Social Services in serving all of California's kinship families. So I'm now going to turn it over to Pete Monso, who is the president and CEO for United Way of California, and he'll share a little bit more about what this program is and how you can get involved.
Thanks, Claire. Good morning, everyone. We're really glad to have you joining us, and we're very excited to share with you this kinship navigation portal that we built. It was based on or grows out of a pilot project that we did in 2012 to 2015, where we tested the design and the approach in 3 counties. Riverside, San Bernardino, and Monterey counties over the course of 3 years. And I'll share a little bit more about what we learned in doing that. It laid the foundation for this program. What is it designed to do? What we're aiming to do is to provide curated, relevant resource information to kinship youth, foster youth, and caregivers, as well as folks who support kinship youth and foster youth and their caregivers to meet their needs, right? And to connect with locally relevant resources that have been vetted by community-based nonprofit experts. So it's reliable, and we think it's much more effective and safe than just going out on Google and looking for stuff and clicking on something that you don't know about, right? We also know that a key part of this project is to try and reach people in kinship care in informal settings, right? And the truth is, we don't know how many children are being raised in informal kinship care because they are not in the formal kinship or formal foster system, right? So California right now has about maybe, I think, 80,000 children statewide in formal foster care. The estimates are 4, 5, 10 times that many maybe in informal care. Probably not 10 times that many, but 4 or 5 times that many. So there's a big world out there of people who may not think of themselves as having access to child welfare supports, right? But there are benefits and resources out there for them, and we want to help them, succeed. And you'll hear many of us that are working on this have kinship care experience in our families, right, in our background, and it's very, very common. In fact, when you start asking people about it, many people share stories, and they maybe didn't know what to call it, but they were in a kinship care situation. This project is funded by federal dollars, and those federal funds come underneath the Family First Prevention Services Act, which is kind of a sea change in how support in child welfare is delivered. The focus is much more on prevention, right? Much more on meeting needs of children and their caregivers, so that they don't end up in the formal foster care system. So we're trying to go upstream and meet people's needs before they need to get into the formal foster care system. What we learned in doing the project the first time was a couple things. One is, a lot of folks said, well, a lot of these caregivers and youth are perhaps low income, or they're not that comfortable with technology. It's going to be very difficult for them to use an online service. And we found that that wasn't the case. People of all ages, right, and all income levels and education levels were quite capable of accessing the resource information and finding things that helped them. We had an evaluation that established that. Another thing we learned, which is interesting, because I'm going to talk about grandfamilies in a minute, grandparents. Often people think that's their image of a kinship relationship, as a grandparent raising a grandchild. But the family situations are incredibly diverse. The kinship caregivers are all ages, so sometimes very young people. Someone might be living with a cousin, right, or an older sibling. So we can't just assume it's all grandparents. But we do know that a sizable chunk of kinship caregivers are grandparents. And as we know a little bit about them from studies that we've done. So, United Ways of California does a study of financial stability statewide, and we look at the cost of living, of meeting a basic standard of living in every county in the state. And then we analyze how many families are struggling to meet that basic standard of living, or decent standard of living. It's roughly 1 out of 3 in the state. And we know for grandparents, for seniors, right, they have special challenges, right? Often they're not working anymore. They're living on fixed income. It can be difficult and expensive for them to meet needs. UCLA Center for Health Policy Research did a study in 2013, which found that the primary caregiver for a grandchild needs more than twice the federal poverty level income to meet that basic standard of living. And we also know that more than half of all older adults in California who live alone do not have enough income already to cover their own basic needs, let alone to meet the needs of grandchildren placed in their custody, right? So, and that's just one slice of the kinship caregiver population. But there are, benefits and resources available to them that they may not be aware of, right? Including benefits like TANF only child, for example, which can really help meet financial needs. And part of our goal in this project is to help reach those folks and let them know what resources and assistance are available to them. We started this late last fall, before COVID, right? And so traditionally, kinship navigation right? And kinship care support is delivered person to person, often by a case manager. This was before, the online model that we're pursuing is kind of unusual. It's kind of innovative. And it's even more relevant now, we're seeing in the age of COVID with shelter in place. A lot of person-to-person services have been disrupted, right? They're not as accessible. And so, we know that people are struggling with trying to get the support they need. And we hope that this online model can help them do that. In our first study, one of the main points we heard from caregivers was, one of the things they appreciated was that this was on demand, that they could access it whenever they needed it, right? So if it's didn't have to be between 9 and 5 business hours for some service agency, they could do it at night, right, or on weekend, and find what they need and access what they need, and it kind of puts them in control. The other thing I really want to mention, and Kelly Brown from 201 Ventura is going to talk about this in a little bit further. A key piece of this is access to live help. So the model is that folks can find the resource they need. They're in charge. They can find information they need. We're providing guided search. It's curated. We're trying to steer them to vetted, reliable resources. But if someone needs live help, they can get it. They can talk to someone over the phone, or they can have a text conversation or chat conversation with a trained specialist, a live person who's been trained in the special needs of kinship youth and foster youth and their caregivers. And we think that's really important feature of this project. And then the last thing is, as we've been engaging experts and community members around the state, what we're finding is, there's a desire to have more community, more contact among kinship youth and kinship caregivers, and we're looking for ways to support that. We already are in small ways, but I think that's going to, as this project grows, be a big part of also what it does. At this point, I think it's time for me to turn this over to Kelly Brown from Interface Child and Family Services in Ventura. Kelly?
Hi, I'm Kelly Brown, the Director of 211 at Interface Children and Family Services, and we're a 24/7 hotline for social services and health services, and take calls for 40 counties. And part of the calls that we take now are the live Kinship Navigator hotline calls. So when someone needs additional assistance while navigating the website, they can contact someone from my team 24/7 to get assistance finding resources in their area. And we're excited to be part of that project, especially for me as a former kinship youth myself. I really appreciate being part of a project where I'm helping families that are kinship families and kinship youth who are searching for help in their area. The kinship navigators here at Interface, the hotline staff, their job is to be a connector to help kinship families from around the state that are calling in to find local resources where they can, unfortunately during COVID-19, obviously probably not going in, but actually make a local connection with the supports that are available to them, and to understand what kind of supports are actually available when they start looking. And we have calls coming in from experienced kinship families that have been a kinship family for a while and are just looking for additional supports, and then new kinship families that didn't even know that there were any supports available at all, and are really surprised to find out what kind of assistance is available to them. The training for the Kinship Navigator staff has come from our in-house trainer here, who is also a former kinship youth herself, and she has brought in many amazing panelists and trainers over the last year to help staff understand what the special needs of the kinship community are. And also we've brought in local kinship organizations here in Ventura County, like Kids and Families Together and CASA, to give us presentations and also training as well. So really excited about the team that's working with us and the calls that will be coming in the future. Now, is it okay if I share my kinship story at this time?
Yeah, that would be great. Thanks, Kelly.
I'll just tell you a quick story about me and my kinship journey here. I actually grew up from 0 to 5 here in Ventura County in a really tiny beach community called Port Hueneme. And I lived with my grandparents and my mother and 3 older cousins that my grandparents were also raising. And we had this big loud house, and I spent most of my days just following my grandma and grandpa around. My mom was in school and working at the same time. Now, I still don't really understand why, but when I was 5, my family decided to move to a tiny farm in Central California. And so it just seemed very sudden to me, at 5 at least, that we kind of packed up a U-Haul and drove to this tiny little house, about 900 square feet in the middle of just nowhere in Tulare County. And the nearest house was 15 minutes away. The nearest town was 30 minutes away. I was not impressed, just hated the whole deal. My kinship family journey, what would be considered a kinship family, really started there, because I found out right away my mom was actually not staying. I stayed there without her. She moved back to Ventura County and I stayed with my grandparents. And I was there with them for 8 years. And we were very poor, but always had enough to be comfortable. But we did rely on boxes of food that we stood in line for, food stamps. And I don't want to tell you how old I am, but they were real food stamps back there, like actually stamps. And we picked fruits and vegetables for the local farmers around. And I still have a lot of respect for the farm working community after working, doing that kind of work when I was younger. My mom would come and visit every once in a while, bring gifts and things, but I really didn't see her very much until I was 13. I moved back home here to Ventura County with her, and I stayed here with her until I was 16, at which time she decided to move to San Francisco with her boyfriend. So for me, at 16, I decided that I didn't want to move around any longer, and I stayed in our apartment. And I worked at the mall, and I cleaned houses, and I kept paying the rent and the utilities myself. And I ended up graduating high school without letting anybody know that I was living on my own. I started college, and when I was 17, I graduated high school and started college at 17. And I met my husband there at college, and we were dating forever, but he was my support through just that amazing time of just trying to figure out how to, navigate life without having those kind of supports that a lot of people have. Now we still live here in Ventura County and own a successful plumbing business. I have 2 gorgeous sons. They're 12 and 14. And I've had 5 other children as a surrogate for 3 different families. And reflecting back on this story so that I could talk to you about it today, I saw, wow, there's been a lot of really challenging and difficult things that I've moved through, but I've also had a really kind of amazing life. I thought kind of like a Forrest Gump kind of a thing going on because, I attended Le Cordon Bleu cooking school. I've been to 8 different countries. I have a degree in finance. I've cooked with Wolfgang Puck and Julia Child, and I'm the director of 211 Ventura now. And I'm working on this amazing program, and I feel like it's all come together, and I'm excited to be part of it. That's my story.
Thanks so much for sharing that, Kelly.
Yeah, that's amazing, Kelly. It's really, I've worked with Kelly for years, and I didn't know all that until we started working on this project, right? And I just want to say a few words about Kelly and 211 Ventura, and also this project a little bit. stuff I was meant to say before handing it over to Kelly. There are about 240 2-on-1 information and referral programs around the country. Mostly are, about half are run by United Ways and the other half are independent, but in most cases financially supported by United Ways. And they're all independent nonprofits. I've gotten to know many of the 2-on-1 providers around the country, and the program that Kelly runs is one of the top handful in the whole country. So we're really in good shape working with them as a key partner. It's amazing what they do. Kelly and her team respond to about 300,000 phone calls and probably serve 3 to 4 times that many every year through text and web queries. And those are residents of 40 counties across California. We're really fortunate to be working with her. The resource data that we use for this project also comes from 2-on-1 partners like 2-on-1 Ventura. So there are, I think, 39 counties in California that have access to 2-on-1 information and referral services. And so we licensed data from most of them. There are a handful that didn't want to license their data, but we've got data from most of them. And in addition, there were 19 unserved counties. California has 58 counties, right? So there were 19 counties that didn't have 2-on-1 service and didn't have resource data sets available before when we started this project. So Claire, Nayeli, Kelly and her team, Jay and Gabby, they went out and built those data sets for those 19 unserved counties. So in many ways, this is a key part of leveraging and building 2-on-1 information and referral service statewide in California for the first time. And again, we're doing it with this special population in mind, kinship, youth, and caregivers. So I'll stop there. Claire?
Yeah, thanks so much, Pete. So now we're going to go in to an actual demo of the website itself so you can all get a feel for it. So I'm just going to go ahead and share the website. So our website is KinshipCareCA.org. Can you guys see my screen? Okay, great. So this is the homepage of our site, and the first page is the search page. So if you scroll down, you see a section where you can actually fill in where you're located, and then you can get help for me or my family or for my clients. So if you were a service provider, you would choose that. Me or my family, you can do that here. So I'm located in Sacramento, so I could just go ahead and write in my city. I could also write in my zip code, which maybe I'll do that. So then we'll get stuff in my location, and then you hit go. And then it takes you to a guided search. And these different search topics were actually curated by several of our focus groups that our evaluation team held. They gave us feedback on what were the most important and priority needs for kinship families and youth throughout the state. So that's how these were selected. So any of these categories, you can click and actually get a drop down with more information on specific categories. So if you were looking for job finding assistance, you could click that, and then you'll get a list of resources that are very close to wherever you're searching. I apologize, that's my dog. One moment. I'm sorry, the mailman.
No worries.
Came right when I was doing that. So you can see there's a whole variety of results that will show up that match whatever you're searching for. And one great feature of this is that you can add anything to a binder. So you can create a special place where you can store information about any of these resources or services. So if I just click that, that will automatically save all the information about this specific program in my binder. And so here is a lot of information that's showed. Again, I won't spend too much time on this because you all can peruse this site at your convenience. But up here, the view binder, that's where I would go if I wanted to see my list of resources, and I can put as many in there as I would like. Another thing that's really important about this site, and both Pete and Kelly mentioned earlier, is that at any point in time, you can always access live help. So by clicking this button, you can either enter your 10-digit phone number in order to receive a call back from our specially trained kinship navigators. So you would just enter that number here, press submit, and then usually within 30 seconds, sometimes up to a minute, you'll receive a call back straight to your cell phone or whatever phone number you entered. You also have the option of calling directly. So you can dial this number on your phone or even call through your computer or tablet or smartphone, however you're accessing the site. And that is on all of the pages. So anywhere you go throughout the site, you'll see the Get Live Help. I'll just go back to the home page for now. Another thing I want to share with you is this blue banner at the bottom that says, "Did you find what you're looking for?" So we're very excited to share this site with you, but we also know that we're constantly going to be making improvements and changes and updates. So we're really relying on you and your communities and all of our website users to help us improve. So at any time, you can always leave information about, a question on a resource. Maybe you didn't find a specific resource you're looking for and you want to learn why. This information will get sent to several of us on this call and a few others. And we're monitoring it by the hour and we'll respond right away. And it's been really helpful. Even if it's something as simple as like, I think this phone number is wrong, or I heard of this resource in this zip code and it's not there. We're always wanting to improve. So that is also available on every site in the page or in the website, every page on the website, sorry. We've got specific resources for COVID-19 information for our kinship families and caregivers that you can locate here. The resource library is just general resources. Most of them are statewide. So if you just want to learn about, caregiver resources throughout the state, you don't want to look specifically in your zip code, this is a great page to visit. We also have a blog that we are updating regularly. So we invite you to read through. We feature kinship heroes and other great resources, and are excited to keep pushing out more materials here. So if you go to the About Us, you can see more information about the program, but also you can see where we have data available. So I think Kelly and Pete also mentioned this. We're working on filling in data for a few counties that are not currently on the site, but everything in blue, there is information about Health and Human Services and kinship specific resources. And hopefully we'll have these filled in the next few months. Contact is just if you want to get in touch with us at any point, you can do that here. You can also, again, fill out information down here either way. And then the only other thing I want to show you is we do have a cool text message feature if you wanted to actually send information about a resource to your cell phone. So I'll go back into my binder. Let me add another, I'll get something about financial management just to add more than one service. So I can add to binder, and then I can click my view binder button, and I have two resources that I flagged and put in my binder. And then at any point, if I want to actually send this to myself, I can click this button that says share page SMS, and then I could send it to my cell phone. And then usually within 10 seconds or so, I'll get a text with all of the program information. So that's a good way to do it as well. So I think that is kind of like, you know, the 30,000 foot view of this site. And I'll open it up now for questions from anyone on the call. Oh, and I see, let's see, Melissa, you shared something. Oh, yes, thank you. Actually, this is good to share out. So Melissa put in here, there is a how-to. So if you are new to the website and are not quite sure how to access resources, this is a great place to start. So it's just kind of a guide for how to use the site, where to start, you know, what the search categories look like, and all of that. Yeah. Do folks have any questions about, it could be about the website or just the program itself? And if so, you can put those in the chat. Okay, so we've got a question here from Zulema. Is information available in other languages? Yeah, thank you for asking. So on each page, you'll see, I mentioned this Get Live Help, but over here on the other side of the page is the Select Language tab. So you can choose, right now we have Chinese and Spanish. So you would click that in order to get translation. And then on that, no, here I'll go back to English. If you scroll down to the Connect button, this is a great way to share out information about the resource. And here we have flyers in English and in Spanish. So this is another good way to share out information.
And there's the widget if you want to put it on your own website or a partner website.
Yep, right here. Yeah, thank you for pointing that out. So you can just use this widget to connect to our site from any other site. All right, I'm going back to our chat. So we have a question. If someone wanted to share their own story on the blog, is there an easy way to send their story? Absolutely, I'm so glad you asked. So Melissa Gersh, who's on the call, maybe you can wave your hand. She is our Director of Communications and Marketing for this project, and she has been working with caregivers and families all over the state on gathering stories. So her contact info is actually in our slide deck. So I'll show you that in a moment, and then you can always reach out via email or call us at United Ways of California, and we would love to connect with you. I'll go ahead and put her info up so that you all can see that. So Melissa Gersh would be the one to get in touch with for storytelling. Oh, and it looks like she put it in the chat as well. Okay, great. Sorry, there's a lot going on in the chat, so I'm just making sure I'm catching it all. So we have a couple notes from our team actually about language. So we are working on language customization via a plugin. So that way, right now it's just a Google Translate of our site into English, or sorry, into Spanish or Chinese, but we're working on making it a much better translation. And then Kelly wanted to share that the live help is available in multiple languages. I think there's over 170 languages that can be accessed. So the site itself is limited at the moment to English, Chinese, and Spanish, but if you wanted to call and connect to a specialist, you could do that in many different languages. And you just either type in your phone number to get the call back or call that 8778 Kinship line. And once you've determined what your language is, you'll get connected to a specialist with that language. Okay, let's see. Other questions. Okay, would the text only be in English? So the texting, if you're texting with a call specialist, it's in English and Spanish. Other questions from folks?
There, I just wanted to add that folks can also text Kinship to 211-211 to be added to the listserv if they want to connect over text and maybe stay in touch around updates.
Great.
I'll put it on.
Yeah, that's a good point. So I didn't put that on the slide, but if you take your cell phone and you text the word kinship to 211-211, you'll get added to the listserv and you can access resources. Thank you, Melissa. That's perfect. She put it in the chat for you all to see. Any other questions from folks? Okay, well, maybe some more questions will come in, but I wanted to direct your attention to different ways that you can get involved with the program. So as we showed you a moment ago, if you go to kinshipcare.org/connect, you can access flyers. There's our widget. So that's a great way to promote the site. We also are very active on social media. We've got Facebook, YouTube, Twitter, LinkedIn, Instagram, and also Pinterest. So here are the links to all of those. We invite you to follow us, to like our posts, repost. We're just really excited to get the word out about this program and are looking for any help we can get on that. And then here is a link to the blog that is updated regularly with stories of kinship heroes and organizations. Okay, I'm sorry, I'm just checking more chats, mostly comments, which are all great. Okay, well, we still have 15 minutes, so we're going to leave it open for more questions or comments from folks. But in the meantime, I want to let you know about our upcoming webinar, which will be on Tuesday, August 19th. It will take place at 9 a.m. And at this webinar, we're really excited. We're partnering with author Beth Tyson, who is a trauma responsive care specialist. And her presentation on this August 18th webinar will focus on trauma-informed parenting. And Beth is the author of a new children's book called A Grand Family for Sullivan, about a frightened koala named Sullivan who experiences big emotions when his life turns upside down as he moves in with his grandmother koala when his parents are no longer able to keep him safe. And then we're going to put a link in the chat to her book. So if you're interested in learning more about the author or the book that she just published, you can check it out there. And we're really, really excited about this webinar. So if you register for this, we'll just send you one email with this slideshow so you can see it, as well as a link to a recording of this webinar, and then also information about the upcoming webinar on August 18th. And there will be a third webinar. We just haven't secured the date yet for that one, but we'll let you know about that as well. Okay, I'm just checking the chat again. So it looks like Melissa put the link to the author's website, so you can check that out. Great. Well, thank you everybody for taking time to join us this morning. We will keep this room open for the next 13 minutes in case any questions come up. Does anyone from our team have any final comments they want to share?
Sorry about the background noise too, but I just wanted to share that it's really exciting to see folks being here to learn more about the project. It really has been a true labor of a lot of people who are committed to this project, and we're only committed as well to keep making it stronger. So we, partnerships have been a big part of it. So we welcome all of you and invite you to share this as a resource for kinship families, and also invite you to share this with families who might not know that they're kinship families as well, not really consider themselves part of, the foster care system, what we would call informal kinship families. They're really the folks that we're trying to reach. And I just want to thank you all for being here as well.
Thanks, Nayeli. Great. Well, if you have no more questions, you're free to drop off, and we'll follow up via email. But like I said, we'll keep this open just in case other questions or comments arise.
Yeah, one thing I would say before we all go, it's just thank everyone for being on. This is early days. We're only the site's been live for 2 months, but the design of the project is for us to learn as we go and to improve. So please don't hesitate to send us suggestions or comments on what we might add or improve. And early on, when I mentioned that we don't really know that much about how many folks are in kinship care situations in the state, I think after a year or more of this, we should have a much richer picture of what the kinship care population looks like, right? In terms of family situation, age, ethnicity, all that stuff that is kind of hidden right now. We want to help make it more visible. And if anyone wants to contribute a story, like I think somebody mentioned, that would be great. We would really appreciate that.
Thanks, Pete. Oh, we got a question. Will a new Zoom link be sent out? Yeah, so we'll be posting about this webinar in the same way that we shared out this one on Facebook and all of our other social media platforms. And then we'll also send out one email to everyone that registered for this that will have a recording of this webinar, as well as how to register for the upcoming one on August 18th. All right. Well, I think we're going to go ahead and end this webinar. If questions do arise in the coming days, please feel free to reach out to any of us. And yeah, we look forward to partnering with you on this going forward. All right. Take care, everyone. Have a great rest of your day and a wonderful weekend.
Thanks, everybody. Take care.
Bye.